Hi everyone. Today we are here to discuss the state of healthcare. This is Manu Agarwal. I'm an industry analyst with Everest Group. I lead our practice for healthcare, and I have a couple of colleagues here with me who's going to be talking about a little bit about healthcare. So a little bit background in terms of why we are doing this, right? So healthcare as an industry, as all of us know, has changed quite a lot, right? For all the right and the wrong reasons, it's been in the news this year. So we thought we'll just take a stock of what healthcare is all about, what's been happening in the industry, and how are we handling the patient experiences in healthcare better. So with that, let me introduce some of the panelists. Jason, let's start with you.
Thanks, Manu. My name is Jason Flucky. I lead the claims team over at Smart Data Solutions. My background is in healthcare operations, end to end, all the way from mailroom all the way through encounters.
And just
And I'm Jason Herr. I've had 30 years in the health administration business, from eligibility to navigation, claims paying, helping big and small clients give their benefits or get benefits to their employees.
perfect. Thanks for joining us. So with that, let's start with one of the most pivotal topics in healthcare, right? We keep talking about what's happening with payers. We keep talking about drug prices. We keep talking about what's happening with hospitals. I feel like we are missing a trick because we don't seem to be talking about the patients and the members as much. So let's talk a little bit about the whole patient experience journey, right? Especially when you think about when a patient enters a health system, when they leave, right? What happens to their journeys? What's the experience they get to? Whether it's about the care part of it or whether it's about the claims, the bills that they might receive afterwards, the enrollment support they need. So a little bit about how the patient experience journeys have been evolving, and then for all the talk of advancements in healthcare, where do we see the patient experience really headed? So Jason, I'm going to start with you, right? Help us get some perspective here.
Sure. Yeah, I mean that's really the reason why we all do this, right? Is really enhancing that patient experience. And our our healthcare industry is very complicated, and so having to navigate that, it can often be challenging even for us in the industry. And so often where we kind of see that intersecting with claims is being able to make sure that we get claims right the first time accurately and then out quickly so that the providers and members, they, get their payments and can be off on their way. But oftentimes what we see is that there's incorrect payments, incorrect anything to the provider, and then oftentimes the member's caught in the middle. So that's something that's near and dear to my heart. Of we get it right the first time, and then that way it's a smooth experience for everybody, for both provider and the member.
Thanks. And just here, you see this in terms of the real life member experiences, right? What are the most common challenges that you see when it comes to implementing the right experience?
Well, I think it's confusion on the employees' part. They don't understand what they're doing. They're sick. They broke a leg. They did something. They need some kind of care. They don't know all the steps, but they need to go to the doctor. Is the doctor treating them appropriately? That's for somebody else to help that doctor, making sure that they're not wasting the employer's money. They need to, in some cases, have pre-authorizations. They don't know what that is. They don't know what that means. They don't know all the steps that have to happen to get that done.
Yeah.
They come back from the doctor, and a month or two later, they're going to get a bill or an EOB in the mail. Sometimes it's a bill. Sometimes it's a bill from the doctor. It could be the EOB from the payer. They're confusing. They just don't know what all that means, and they need help. And then in some cases, the payer will deny it. That's not approved. And then the patient goes, "What do you mean not approved? I have insurance. Why aren't you paying for this?" So it's complicated, and they need help. And then just all the data that goes into helping the payer, the administrator, get that is not always smooth either. So that portion is complicated for the employee. They don't even understand it to begin with. And the employer can be part of this. And again, it goes back to smooth and the back end so that the member can have a good experience with the doctor and get better. They don't need the stress of the confusion around it.
And in your experience, where do these complexities kind of stem from? Is it mostly because of organizations and how they're designed? Because we keep hearing that we often start with the right intent of designing the best experience, but then along the way, sometimes things might go off, right? So is there a reason behind why some of these things happen?
Oh, there's lots of reasons. When you think about how a person, an employee gets coverage, it starts with HR getting hired into a system, into an HR system, that data getting sent to maybe an eligibility determination, having them in the right plans, because some organizations have multi-tiered plans, and you got to have the right information to know what plan to put them in. That has to get sent to a payer. So that's a part of it. And then all the data coming back and forth from the provider on what was actually done with that employee. Was it a broken leg? Are the benefits being, or is the procedures being sent correctly back to the payer? Right. And then you put in the part of the payer has to have it programmed correctly to pay the bill. And then you're going to put in a network in there too. So there's lots of data being transmitted around the U.S., and it's not always perfect.
Thanks for that explanation. I think this puts a lot of things and the complexities into context. So let me take us a little bit forward, right? Let's talk about what would it take for us to fix these experiences, and let's focus specifically on the claims part of it, because those bills that you mentioned, those explanation of benefits, the EOB documents you mentioned, I've received one of those. And it wasn't really the easiest one to explain, even though I am in healthcare. So when the first time I got those, it took me a while to understand what that is. So let's talk about, okay, what would it take for us to fix the claims journey? And Jason, if I'm going to start with you, help us understand, right? What can we do differently to actually drive better claims experiences? First of all, why are these broken? And then what will it take for us to fix them so that patients actually understand what they're going to receive when they see an EOB, an explanation of benefits, or a bill, or any other documentation that they receive from their plans?
Yeah, I mean, as Jason H had mentioned, is that each one of these different processes, whether it be explanation of benefits, providers, eligibility, is that all of these are incredibly complex workflows that often take subject matter experts to even navigate each respective workflow. So to be able to take all these disparate data, put it into one, get it to where you need, it's a lot of what we do at Smart Data Solutions. But it's really having those feet on the ground, know the things, how they all interact, and be able to start putting that healthcare puzzle together that really kind of creates that journey, at least from a claims perspective. And so having the right people in the right places, because oftentimes at open enrollment periods that claims will often see surges in claims, that there's issues with eligibility files. So even before payment even goes out to the providers, that we're often having to fix issues upstream of that, right, before we can even get to that. And so some of the ways that we solve these solutions is having subject matter experts over several systems that will go into a payer system, adjudicate claims, audit claims, and really kind of create those safeguards to make sure that from a payment perspective, everything is looking how it needs to as it goes through that payment continuum.
Got it. So let me kind of unpack that a little bit more, right? So one of the things that we keep hearing from a lot of plans, providers, TPAs is that a lot of times the members are calling in because they are disgruntled. They've gotten stuck with a bill or a document they don't understand. By that time, you've sort of already lost the experience to a certain extent, because the only reason they're calling in is because it's an escalation. Mm-hmm. So an ideal experience would have been where you can intervene on this before even the document went out, before a patient or a member saw any of these documents. That's what I think you're referring to, that how can you bring those journeys more upfront? So now I'm going to move to you, right? So when you hear some of these things, when we talk about the roles of tools, technologies, people who understand these processes, and all the complexities of healthcare, how do you think the new journeys need to be defined for patients and members so they can understand what this looks like?
Oh, that's a great question. And we need to make it simpler for the patient to understand what they're entitled to receive and what impacted and what needs to be done differently to get unstuck in a case of it being stuck. In an ideal world, the claim comes in, it's properly coded, it goes through, it's auto-adjudicated, and the provider gets paid quickly and accurately. The patient understands what they're responsible and what was covered. The employer would sure like to get some credit for the dollars that they're spending on behalf of the employee as well. So having an easy way for the patient, the employee, the dependent could be, to understand their benefit and how well it went for them. And like I said, and if it is stuck, how can organizations, maybe it's AI, maybe it's robots in the future, unstick it more quickly and ideally so that the patient never saw that it got stuck?
That makes sense. But at the same time, I also look at the kind of complexities that we have in healthcare, right? So there has to be better experiences, better tools that we kind of use to solve for this. So think about an average plan or a provider, right? They have to deal with mails and faxes and electronic documentation and paper documentation. There's doctors' call notes flying all over the place, right? So the complexity in the system is just enormous. So I really want to move towards that system. But yeah, I understand where some of those things kind of go off. The good thing we see is that now see so much tools, technology, so many people who have deep expertise in healthcare who know how to solve for this. We have deep talent in healthcare, which is growing by the year. But yeah, I think we've headed in the right direction, but I still see some ways before we are able to solve for all of these things.
Yeah, I think there's complexities are everywhere, right? It's on the provider side, it's on the member side, it's on the payer side. That even the other day, my brother called me about an EOB or explanation of benefits that he received on a vision claim. And he's like, well, I thought my medical would cover this. And I asked him about his vision. And he said, well, HR told me this and this person told me that. So you're having all these inputs into the member experience where some of them may be partially right, partially wrong. But again, it's having them try to navigate, ask the right questions to get the right answers to be able to, get that, see if that copay was legitimate or if the claim was processed correctly.
Yeah, and if you think about it, everything that's been happening recently, right? The whole talk around, hey, Medicare expansion, Medicaid spend cuts, I think this is going to get probably more complex. Now you're going to have patients walking into a high health system, and even the hospitals don't know what their coverage looks like. Am I going to file this with the state for the Medicaid? Am I going to file it with CMS because there's some Medicare coverage that they have, or do they need to be covered out of pocket? Is it going to be more exchange enrollments? So I think the complexity is just going to continue to rise given some of the recent changes.
Well, and I'll add on that employers are changing their plan. Healthcare has become such a big expense for them. They need to find ways to trim the costs. They cannot continue to grow at the rate they're going because it's taken too big a margin for them. That's the reality of it. They need to make money as an organization as well. So they may change a plan benefit 1 year to the next, and an employee or a dependent went to have a procedure. In December, it was covered at one rate, and in January, it was covered at another rate. And how do you help them understand that there was a change? So we need to have better communication. It comes back to how do we teach and how do we help people understand the benefits they're getting and what drives them.
Thanks for helping us understand what would it take for the claims to move forward. I know we talked a little bit about the experiences. Let's talk about what do we as organizations need to do to kind of make it happen. So I'm referring to the more change part of it. So when you think about all the tools we talked about, hey, we have had automation for years, right? We've been talking about automation for at least now 15 years, maybe 20, right? But till this date, I don't think I've seen any plan that has everything automated end to end, right? And I don't even see a future where I can say, hey, it's going to happen in the next 5 years. Is it going to happen in the next 15? I still don't know, right? Similarly, when you think about any of the data access points that we talked about, there too, we have made strides, right? The EHR, EMR implementation, the health record stuff, electronifying of those, all of that has happened over the last more than a decade now. But we still see a lot of paper floating around. So let's talk a little bit about what would it take for organizations to kind of advance forward, right? Again, Jason H., I'm going to start with you this time. Given that you see this as a TPA, you see this, how organizations are dealing with it. What do you think are those big changes that any organization needs to make? Whether it's internal changes, whether it's external changes that needs to come from regulators or industry environment, what would that look like to advance this needle once and for all?
Well, I think it starts in the trenches. The people with their hands on the keyboards, the people that do the work every day, we need to make sure that they have buy-in and they know why we're doing or why we're putting in a new system and how it's good for them. Resistance at that level causes lots of problems in organizations. So we need to make it simpler, faster, easier, and show them the benefits for them and how that benefits the organization as well. And we have to make sure that all that work in the end benefits the patient. They need a seamless experience. We want to get the providers paid quickly and accurately. The employers want that as well because it's coming out of their pocketbook or the reinsurer. So in my mind, it is about creating systems and solutions that are easily implemented, easily changed, and catch data anomalies quickly so it prevents problems. Right now, there's so many disparate systems that impact how a claim would be paid. How do we bring them together so that the data that's being transmitted back and forth, whether that's a piece of paper data or an EFT data, is input correctly, and it's catching fraud, waste, and abuse as well, because that's out there too. So it's a rambling way of saying we need more integrated solutions that get the data from here to there in a accurate way.
Fair enough.
And I should add too, and the dollars back and forth in a timely way too, because in the end, that's what the TPA is there for, is to get the dollars to the right place.
Yeah, and if you just look at the amount of wastage we have in the system because there were incorrect claims that need to be recovered later, or underpaid claims that need to be paid later, and then the whole administrative burden around it, the amount of money you spend to recover the wrong claims, that's just enormous. So
yeah, and the cost to the TPA, the cost to the employer through appeals, extra phone calls, whether it's the provider or the patient, or the broker getting involved. When things don't go right, there can be a lot of people that want to make a phone call, and those phone calls, some of them are just a waste of money and a waste of time for all involved. So we need to make it more seamless and more accurate and more quick.
absolutely. So Jason F., right? When you think of healthcare enterprises who have done this right, what do you think are some of the common characters? What do you think they do differently, which helps them implement these changes better, faster, more seamlessly? What do you think is the common variables between organizations who get it right versus the ones who struggle on these journeys?
Yeah, I think the biggest thing that comes to mind is really the focusing on the people aspect of things. Is that at the end of the day, is that there's people involved in all parts of these processes, and being able to understand and realize is that the work is changing and evolving, but the people will still always be there. So, being able to look at something from an automation perspective is that automation isn't going to replace someone's position. It's going to allow us to get claims out quicker at a higher accuracy percentage, but we still need people to oversee this process and to keep on identifying new processes to be able to automate and to streamline everything. And the other biggest thing is really just the flexibility, is that even from a regulatory perspective, whether that be federal or state, is that we are in constant flux all the time when it comes to healthcare. And so it's being able to change with the regulations, change with system upgrades, system changes, those type of things. And that's really, what allows successful organizations to really create that seamless experience for the member.
Makes sense. So let's summarize some of the things that we discussed today, right? So we talked about how we have the right tools, but the application of those tools doesn't seem to be the perfect, right? Sometimes it's basically people who don't either understand them, or maybe they need to be trained better so that they can leverage it better. We've been talking about the data problems in healthcare for a long time, and now we have so much data journeys that every one of us has been on. But despite that, we haven't seen those results. We keep talking about shift left and shifting the data left, right? We have done that in many places, and some results are there, but we're far away from having that seamless end-to-end healthcare experiences that both of you described. So what would the final takeaways for today look like, right? What would it take for us to get to that healthcare journey? If you were to think of top one or two action items that our viewers can take away, which would really help move the needle, what do you think are the top two things that each of you would win? Jason F., I'm going to start with you, and then I'm going to move to Jason H.
Yeah, I think the thing that comes top of mind, and as cliche as it may be, it's really collaboration between everybody, providers, TPAs, any vendors that they're using, and really to have kind of that open and honest dialogue of where we feel that workflows are falling short or expectations are not being met. Because I think far too often that we're okay with the payer being paid late, or we're okay with this kind of thing. But really, we just need to kind of push for that excellence and have the open discussion to say, point out the gaps and how can we fix them and make them better for everybody.
Thanks, Jason. Those are helpful thoughts. So Jason H., I'm going to go back to you. So help us bring it home, right? What are the key takeaways? What do you think would really help us move this needle?
There's a couple things. I think helping the member understand their role in this journey as well, making it simple for them to understand what pieces and what parts they can do, will help their experience, help the providers as well, because they know what they need to bring to the provider to help with them getting paid appropriately. So making it clearer for that member would be hugely beneficial for all involved.
That's helpful. So I think this was a helpful conversation. I hope our viewers enjoyed it. I think for me personally, it was very helpful to see how we're thinking about the whole journeys for members, right? For plans, for providers, and what it would take to kind of drive that end-to-end seamless experience. Why are some of these things kind of stuck in the back end? I know we are living in uncertain times. We keep talking about how these end of the year enrollments would kind of change the priorities for everybody around. But honestly, in the current regulatory and policy environment, that changes are happening almost every month. So I don't know if this is just an end of year thing versus it's just all around us. So how does everyone stay that course, right? Staying that focus in terms of this is the experience we want to drive, without letting our day-to-day kind of distractions take over. So that's what I would really hope the organizations are able to figure out, because I think that eventually will help us move the needle maybe further than anything else. So thanks again, Jason H., Jason F. Thanks for having this conversation. I hope our viewers enjoyed it. And I look forward to doing this again sometime soon.
Thank you.